we are young, the lens inside the eye, which sits in the middle of the eye, is transparent. And with progressing of the age, more and more protein condense inside this natural lens and makes it cloudier. And this affects the vision, and we call it cataract at that point. The majority of patients start to get a bit of blurred vision over the time, and that affects their day-to-day activities. And some other patients come with symptoms of glare when driving, especially at nights, where the lights start to shine and radiate over any spotlight. Very occasionally, some other patients come with the symptoms of double vision coming from one eye side only, and others get a bit of distorted vision. Any type of cataract can cause any one of those symptoms, especially the blurred vision. The majority of patients start to get a bit of blurred vision over the time, and that affects their day-to-day activities. And some other patients come with symptoms of glare when driving, especially at nights, where the lights start to shine and radiate over any spotlight. Very occasionally, some other patients come with the symptoms of double vision coming from one eye side only, and others get a bit of distorted vision. Any type of cataract can cause any one of those symptoms, especially the blurred vision. The diagnosis of the cataract is made by the ophthalmologist using this slit lamp machine, like this one of them here, and where we can look at the lens and look that it's cloudy and diagnose the cataract. And also with the assistance of the dilating eye drops to dilate the pupils. Not every cataract means we need to rush into doing operation. Some cataracts are pretty mild and they don't affect the vision and they don't bother the patient. On those cases, we simply monitor the eye and we ask the patient to review back again within a few weeks or few months or so. On the other hand, if the cataracts start to cause problems to the patient's vision and they are not mild, then we offer the operation. So the operation is the first line treatment for cataract with high success rate. The majority of the cases are performed under topical or local anesthesia. So it is a day case. It lasts any time between 15 to 20 minutes up to 45 minutes if the cataract is pretty more complex. But the majority of patients can continue their normal activities within a few days. We always advise patients not to rub the eyes for a few days and to expect a slow and smooth recovery. But many patients can resume driving, for example, from week 2, unless there is any exceptions. And also patients can just go back to their day-to-day normal activities after that. Of course, we also need to ask the patients to apply some antibiotics and anti-inflammatory eye drops for at least 3 to 4 weeks after the operation to avoid any unnecessary infection or inflammation. Unfortunately, there are no lifestyle changes or particular things we can do or avoid to stop the cataract from progressing. For example, the direct exposure to the sunlight can trigger or accelerate the cataract. There are no particular type of food that can also affect the cataract developing. So it is one of the parts of the wear and tear, and it is actually inevitable to develop over the time. There are a few diseases like diabetic or also the shape of the eye where people are highly short-sighted, or people who take systemic steroid tablets for any reason those would need to expect to develop cataract relatively earlier than a standard person.